class. In this discussion, we will be discussing about hookworms, Strongyloides, Enterobius, and Capillaria. For this particular topic or modules po, here we have the following nematodes or parasites. So here first we have Enterobius vermicularis. Enterobius vermicularis is otherwise known as the pinworm, Oxyuris vermicularis, sitworm, or social or society worm. And then aside from Enterobius, we will be also discussing about Capillaria philippinensis, otherwise known as the pudok worm or mystery worm. And then here we have 4 different entities under hookworm. We have Necator americanus, Ancylostoma duodenale, Ancylostoma brasiliense, and Ancylostoma caninum. These 4 po are under hookworm. For Necator americanus po, Necator po is otherwise known as the New World hookworm, American hookworm, and American murderer. Letter N, Necator. Letter N, New World. And then we also have Ancylostoma duodenale, Old World hookworm. Take note of the difference again. Necator, letter N, New World, Ancylostoma, Old World. And then for the Ancylostoma brasiliense, ito naman po mga hookworm that can be found in cats, hence the term cat hookworm. And we also have the Ancylostoma caninum, caninum as in canine or dogs, otherwise known as the dog hookworm. Aside from the hookworms, in this particular modules or topic, we will be also dealing with Strongyloides stercoralis, which is otherwise known as the threadworm or military worm. So here are the other nematodes pa po that we will be discussing in this. Okay, for next here we have the infective stages of the following parasites. So again, let's just recall when we say it is the infective stage, it is the stage wherein pag ito ang pumasok sa loob ng katawan, it can cause possible diseases or infection. For Enterobius, the infective stage is the embryonated egg, while for the hookworm, the Strongyloides, and the Capillaria, they have the L3 larva or the filariform larva as their infective stages. So for Module 4, we will be comparing hookworms and Strongyloides stercoralis. So first here we have the hookworms. Although I have mentioned earlier, we have 4 different entities commonly for hookworms. But the main 2, yung dalawang pinaka-main talaga is the Necator americanus and Ancylostoma duodenale. Under the hookworms po, disease association is with iron deficiency anemia. Again, for hookworms, that's iron deficiency anemia characterized by microcytic hypochromic RBC. Again, hookworms connected with iron deficiency anemia is connected with microcytic hypochromic RBCs. And then aside from the iron deficiency anemia or IDA, hookworms is also associated with the Wakanas disease. And then for the mode of transmission, hookworms are commonly acquired through skin penetration. So pwede po siyang dumapo sa inyong balat and then it can penetrate your skin. But aside from skin penetration, hookworms is also possible through vertical transmission or congenital transmission from mother to child during childbirth. So that is possible as well with hookworm. And again, for the infective stage, the stage wherein pwede kang magkasakit pag ito ay pumasok sa katawan, that is the L3 larva or the filariform larva. While for the diagnostic stage, again, recall ko lang, diagnostic stage is the stage wherein if this is the stage that you can see under the microscope or the stage that we can diagnose the parasite. For the diagnostic stage, it is the eggs with 2 to 8 cell stages. Ito po yung particular picture ng ating hookworm. Again, that is eggs with 2 to 8 cell stages. Ito po yung example picture. And then, recall ko lang po, the dog hookworm is known as the Ancylostoma caninum. The cat hookworm is the Ancylostoma brasiliense. The dog and cat hookworm can cause cutaneous larva migrans, also known as the ground itch or creeping eruption. Because ito yung name niya, ground itch. Again, our hookworms are commonly acquired through skin penetration, especially po pag nakapaa, and then walang tsinelas, nakaapak po sa lupa. So, ground. And then, yung itch naman during skin penetration kasi, yung ating mga hookworms can cause disturbances and cause itching. So, that's why it is known as ground itch or creeping eruption. For the life cycle of hookworm, it's very simple. So, an adult, a male and female in the small intestine. So, male and female, they can mate and then they can produce the babies in the form of eggs. So, eggs in the feces. Once the eggs po napunta sa lupa, they can develop. So, from the eggs, they can become the rhabditiform larva. Rhabditiform larva is known as L2. And then, we also have the filariform larva, which is now known as the L3. And then, recall ko lang po, the L3 larva is the infective stage of the parasite hookworm. And this filariform larva can penetrate the skin of an unsuspecting person. Especially po yun nga, yung mga nakapaa, hindi nagchichinelas. So, pwede pong pumasok yung hookworm dito sa skin nila causing an infection. And then, ayun lang po, ikot lang po ng ikot ang life cycle ng hookworm. So, again, that's adults. And then, eggs in the feces. The eggs po will hatch and then comes the rhabditiform larva or the L2. And then the L3 is the filariform larva. And then the filariform larva, again, the infective stage will penetrate the skin and can cause infection. And then meron pong sinabi lang dito na additional note lang natin regarding the eggs or the ova. Take note that the Necator americanus and Ancylostoma duodenale, they have the same egg morphology. Again, the Necator, and the Ancylostoma duodenale, again, they have the same egg morphology, meaning iisa po ang itsura. We cannot report either Necator or Ancylostoma as a definite species. What we can do in reporting is we can report hookworm species. Again, when we are reporting for the hookworm, especially when you see the diagnostic stage, which is the eggs or the 2 to 8 cell stages egg, again, we do not report Necator or Ancylostoma because they are basically the same. So the best reporting is hookworm species. Okay, although the eggs is having a same morphology, we can actually identify the adult worms. So, yung mga adults, pwede po nating ma-identify kung Necator, Ancylostoma duodenale, brasiliense, or caninum. So, to identify the species of the 4 hookworm, you can use the anterior portion or yung taas na portion po ng ating parasite. In specific po, yung bibig nila. So, that's the anterior portion. For the Necator americanus, it has a cutting plate. Again, for Necator, it has a cutting plate. Ito po, mukhang kalahating pinggan. So, Necator americanus, again, cutting plates. For the Ancylostoma duodenale, duo means 2. Again, duo means 2. It has 2 pairs of teeth. So, this is the first pair. And here is the second one. So, yun po yung Ancylostoma duodenale, again, having 2 pairs of teeth. And then, Ancylostoma brasiliense, 1 pair only. While for caninum, 3 syllables, caninum. And this has also 3 pairs of teeth. So, this is how, again, you will identify the species level using adult worms. And then we can also identify the gender of our hookworm using the posterior portion naman. Again, we can identify the gender of our hookworms using the posterior portion. For the male, they are commonly broad. So, malapad yung kanilang anterior portion like this. So, derecho and then malapad. While for the female, commonly the posterior portion is pointed like this naman po. So, kung ito malapad, si female po, they have this pointed na posterior portion. So, again, that is how you identify using the posterior portion. How we identify the gender. Again, male is broad, female is pointed. For the laboratory diagnosis of hookworm, the final diagnosis is made by finding again the characteristic eggs or yung diagnostic stages nga natin, yung 2 to 8 cell stages. Ito po yun. So, commonly ang itsura ng ating hookworm eggs po, very thin lang yung shell niya. Diba? Parang manipis na manipis lang yung shell and then yun nga po merong parang 2 to 8 cell stages na nagpatong-patong po at mukhang merong buhangin sa loob. So, typically, this is performed through direct fecal smear, yung common po na ginagawa sa fecalysis. But aside from DFS, we can also do Harada Mori, examine with the 10 times objective or the low power to detect infective third stage motile larva of hookworms, or we can also detect free living and infective third stage filariform larvae of Strongyloides. In light infection, concentration technique may be required. So pag masyadong konti yung ating parasite, we need to concentrate the stool first so that we can identify hookworm. For the treatment, the current treatments naman talaga for the nematodes, commonly yung mga azoles nga like mebendazole, albendazole, and flubendazole. Thiabendazole, either topical or systematic, has been successful for creeping eruption. Topical po yung pinapahid lang sa skin. And if significant anemia is present because ano nga po ang kinokos ng ating hookworm? Anong klaseng anemia? Again, that's iron deficiency anemia. So kapag nagkaroon ng iron deficiency anemia, ang treatment of course is iron therapy first. We need to correct for this first bago po tayo magbigay po ng ating mga drugs of choice. Kailangan maayos muna natin yung iron deficiency. So, yan po ang treatment for hookworm. For prevention and control. So, hindi po naman natin, lagi ko naman po reminder, hindi po natin kailangan kabisaduhin yung kaniyang mga prevention and control, lahat ng parasite. Ang kailangan natin i-take note dito is ano ba ang mode of transmission. Kasi kung alam ang mode of transmission, kaya natin ngayong i-prevent yung parasite. For the hookworm again, the mode of transmission is skin penetration. So, para hindi ka magkaroon ng hookworm, para hindi mag-skin penetrate, mga possible na gawin? Hand hygiene, personal hygiene, of course, the sanitary disposal of human excreta or stool kasi ang hookworm eggs pa naman, nanggagaling pa rin sa feces. And then, ito very important, again, dahil skin penetration tayo, commonly sa lupa, lalo yung mga hindi nagchichinelas, the prevention now is to wear shoes and slippers to avoid skin contact with the infective filariform larvae in contaminated soil. For the treatment of infected individuals, para hindi na lalong kumalat yung sakit, mass treatment kapag mataas ang incidence rate, and correction of anemia nga po in case of iron deficiency anemia by giving adequate diet and iron therapy. So that is the prevention and control measures for hookworm. Okay, next parasite natin here, we have your Strongyloides stercoralis. Again, that's your Strongyloides stercoralis. Strongyloides stercoralis is commonly known as the threadworm and military worm. Again, threadworm or military worm. Pinangalanan po siyang military worm because there was a case po in the US military po na kumalat ang Strongyloides stercoralis doon sa military department nila. So, yun po yung isa sa bansag sa kanya, military worm, because of that reason. And then, disease association for Strongyloides stercoralis, we have your Cochin-China, diarrhea, and strongyloidiasis. For the mode of transmission, same with hookworm, parehas po sila na skin penetration din po ang Strongyloides. And then, infective stage, yung stage nga po na magkakos ng disease, that's L3 larva or the filariform larva. The difference po of Strongyloides stercoralis versus hookworm, the diagnostic stage. Again, the diagnostic stage, ito po yung stage na makikita sa microscope. Kung ang hookworm, eggs ang nakikita or ova, Strongyloides stercoralis diagnostic stage is actually a larvae. L2 larva or rhabditiform larva. Ito po yung itsura nun ng ating Strongyloides stercoralis L2 larva. And then we have here the L1 and L2 larva morphology. We can remember the phrase large SB. Ayan, parang umu-order lang sa Starbucks. Large SB. As in, large, genital primordium, short buccal cavity. Again, large genital primordium, SB, short buccal cavity. That is the characteristic morphology of the L2 larva of Strongyloides. Again, that is large SB, large genital primordium, short buccal cavity. So, here is a comparative study on hookworm and Strongyloides stercoralis larvae. So, again, yung ating pong Strongyloides, they have large SB, large or prominent, this one, genital primordium, and short buccal capsule or cavity. And then, si hookworm naman po kabaliktaran niya. Kung ang Strongyloides buccal capsule is short, hookworm is long. Well, for Strongyloides genital primordium, prominent, hookworm, small. Baliktad po sila. For the L3 larva naman, for the L3 or the filariform larvae, esophagus of our Strongyloides is longer, while for hookworm, it is shorter. For the tail end naman po, commonly the Strongyloides is notched and the hookworms are commonly pointed. But both of them po, they are sheeted. So again, this is a comparative study on hookworm and Strongyloides stercoralis. Huwag kakalimutan yung large SB, that's large or prominent genital primordium, and then short buccal cavity, that's for Strongyloides. Yung hookworms po kabaliktaran lang, long buccal capsule, small genital primordium. So yan po ang ating comparative study for the L1 or L2 versus the L3 larvae of hookworm and Strongyloides stercoralis. Okay, so dito po makinig maigi. Medyo complicated po no ang life cycle ng ating Strongyloides stercoralis. Makinig po. So for this particular one, we have 3 possible life cycle. 3 pong pwedeng life cycle ng ating Strongyloides stercoralis. Kaya nga din siya pinangalan ng strongy as in strong kasi po very strong ang ating Strongyloides. Sometimes pwede po siyang mag-live inside our bodies for up to 20 to 25 years. Ayan. So sometimes they can go undetected. 25 years ka nang infected ng Strongyloides. Ganun sila ka-strong. And then aside from 20 to 25 years, so pwede kang magkaroon yan, ganyang katagal. Ayun nga po, meron po siyang 3 possible life cycle. Pwede siyang mag-enter sa 3. The first one, this one, tingin po dito sa color red. The first po na life cycle na pwede niyang gawin is free living in the environment. Again, the first po na life cycle can be due to free living in the environment. Basically, nasa lupa lang sila. So, walang host dito. Hindi po kailangan ng host kasi nga free living. Pwedeng mabuhay sa gilid-gilid. So, pwede siyang ganon. And then, the second life cycle naman po is yung typical na life cycle ng ating mga parasite. Like, for example, the rhabditiform larvae in the intestine are excreted in the stool. And then, the rhabditiform or the L2 larvae po, pag napunta siya sa lupa, this can develop into the filariform larva or the L3. And then, si L3 ngayon, si L3 po yung ating infective stage. Pag nasa lupa yung L3 na yan, tapos wala tayong tsinelas, pwede po silang mag-skin penetrate in our skin. So, pwede silang mag-skin penetrate sa paa, for example. That's one of the most common na nangyayari. And then this L3 larva po can enter the host and then the cycle po, yun lang, magiging adult worms na naman, magpo-produce na naman ng mga panibagong eggs hanggang sa maging larvae na naman, lalabas na naman sa stool, and then from there, magde-develop to L3 and then repeat. Again, the second life cycle is a typical parasitic cycle. And then, the third possible life cycle of our Strongyloides stercoralis is auto-infection. Recall ko lang, no? Ano po ibig sabihin, class, ng auto-infection? Again, it means po self-infection. You become your own source of infection. So, auto-infection. That's the third possible life cycle of our Strongyloides stercoralis. Pwede mong ma-infect ang iyong sarili. Okay, so again, let's just recall po the 3 possible life cycle of Strongyloides. Again, that's the first one is free living in the environment. The second po na possible life cycle is a typical parasitic cycle. And then the third possible life cycle is through auto-infection. So yan po yung tatlong possible na life cycle ng ating Strongyloides stercoralis. And then aside from Strongyloides stercoralis, we also have additional species po no, na mga bago. Strongyloides fueleborni can cause swollen belly syndrome. Ayan po, na mamaga yung belly or yung sa may abdominal part ng ating katawan. So again, that's Strongyloides fueleborni causes swollen belly syndrome. Okay, so for the laboratory diagnosis of Strongyloides, commonly, ayun nga po, makakahanap pa rin tayo nung diagnostic stage nga na rhabditiform larvae or the L2. Again ha, ang diagnostic stage ng ating Strongyloides is L2. The findings of L2 or the rhabditiform larvae in the feces can be done through the typical direct fecal smear. But aside from that, same thing po with the hookworm. You can also perform here harada mori. And then duodenal fluid collected via aspiration or string test should be examined if the feces are negative, and then the duodenal fluid gives a slightly higher positive finding in comparison po with stool. Eggs can only be obtained by drastic purge or duodenal intubation. And serological procedures such as the ELISA and the IHA are also readily available for Strongyloides stercoralis. Treatment, azoles pa rin kasi nga ulit-ulit tayo pag nematodes, azole, like albendazole and thiabendazole. For the prevention, ayun, again, bago natin malaman kung paano i-prevent, alamin natin ang mode of transmission. Again nga class, what's the mode of transmission of Strongyloides? That is skin penetration. So, kung ganon ang mode of transmission, paano natin yun mape-prevent? So, improved sanitation, proper personal hygiene, prompt treatment, and use, of course, of shoes and slippers to avoid contact with contaminated soil containing the infective stage. These are good preventive measures for this parasite. Okay, so here we have your next module, Enterobius and Capillaria. Enterobius vermicularis. Enterobius vermicularis is commonly known as the pinworm, society worm, and sitworm. So marami pong other names ang ating Enterobius. Enterobius po, it is one of the most common nematodes as well. Parehas ni Ascaris. Mataas din ang cases niyan from time to time here in our country. Disease associated with Enterobius vermicularis is oxyuriasis, enterobiasis, and pruritus ani. Pruritus ani po is yung sobrang pangangati ng puwet. Okay, so ayan. Pag excessive yung pruritus or yung pangangati ng ating puwet, ayun po, possible na po o na magpatingin for Enterobius. It's one of the most common po na manifestation ng ating Enterobius, yung makating-makating bottom or puwet po. Pruritus ani po yon. For the mode of transmission, it is commonly acquired through ingestion but mainly through inhalation. So again, Enterobius vermicularis can be acquired through ingestion but more commonly inhalation. Pwedeng ma-inhale po. Yung infective stage natin na embryonated egg. Ito po yon, tingin dito sa screen. This is the embryonated egg of Enterobius vermicularis. Diagnostic stage of Enterobius vermicularis is the eggs. Ito nga po yun yung nasa screen. Loop-sided D-shaped. Parang letter D. Katulad po nito. Ito, mukha siyang ganyan. Tapos, may concave area dyan. Mukha siyang letter D. So again, for Enterobius vermicularis, eggs, loop-sided D-shaped. And then sometimes, Italian bread ova, yung kanyang characteristic kasi mukhang Italian bread. Dahil po dun sa characteristic shape niya nga na letter D, D shape. For the diagnostics test, medyo iba po ang diagnostic test ng ating Enterobius. Ang ating Enterobius po diagnostic test is the Scotch tape prep, cellulose tape, or the cellophane tape prep. Palagyan po ng star, ito pong info regarding the Scotch tape swab or Scotch tape prep. This is collected early morning after awakening, no bathing po, and bawal maghugas po. So baka kasi ma-wash out yung ating parasite. So again, collected early in the morning, pagkagising pa lang, diretso tayo sa laboratory, bawal munang maligo, tsaka maghugas-hugas. Hanggat sa hindi pa natin na-perform ang Scotch tape swab. Itong Scotch tape swab na to, typically ang gamit po dito, glass slides. So yung glass slides po na yan, lalagyan nyo po ng tape. Tapos yung tape na yon ididikit nyo po doon sa butas ng puwet mismo, dito. And then, titignan nyo po yan ngayon under the microscope para makita po itong loop-sided D-shaped egg po. So for the life cycle of the Enterobius vermicularis, so again, our infective stage here is the embryonated egg. So eggs on the perianal fold, yung butas ng puwet po yun. So larvae inside the eggs mature within 4 to 6 hours. Yun po yung rationale behind kung bakit kailangan sa umaga. Kasi sa gabi, commonly, the gravid female migrates to the perianal region at night to lay eggs. So yung babae daw po na parasite po, nangingitlog daw po siya, pumupunta siya doon sa merong butas ng puwet para doon daw po siya mag-lay ng eggs niya. And then typically, it will take around 4 to 6 hours before the eggs can mature and can become infected. So, yun nga po yung rationale na parang simula around 11 p.m. or 12 a.m., bibilang ka ng 4 to 6 hours para pagdating sa laboratory, siguro around 6 a.m. or 7 a.m., fully matured na po yung eggs, makakakita na tayo ng embryonated egg na loop-sided D-shape. And then, yun po, once na naging embryonated egg ang ating parasite, this can be ingested or inhaled by humans po causing infection. And then, yun lang po, pag pumasok na sa katawan, gano'n na naman, male at female, magkakaroon ng babies. And then, si gravid female nga or yung buntis na babaeng parasite, lalabas po sa butas ng puwet para mag-lay ng eggs doon during at night. And then, it takes around 4 to 6 hours. So, kinabukasan sa umaga, makikita po natin ngayon yung embryonated egg that can once again be ingested or inhaled by humans. And then, the cycle will just repeat, and repeat. Okay, so again, for the laboratory diagnosis, so pinworm infection is suspected in individuals that shows perianal itching, ayan nga po, yung sobrang pangangati ng puwet, insomnia, and restlessness. Hindi kasi makatulog dahil sa sobrang kate. And then diagnosis again is made by finding the characteristic eggs, yung loop-sided D-shaped eggs, using the cellulose tape, anal swab technique, or yung Scotch tape nga. In only about 5% infected patients are eggs found in the feces. Hindi po common yung direct fecal smear dito. Ganito lang po yung percentage na nagpa-positives. That's why the Scotch tape swab is the best practice po for lab diagnosis. And then ito po palagyan ng star or highlightan sa notes. The sample should be collected again soon after the patient awakens in the morning and before he takes a bath or defecate. So bawal maligo, bawal maghugas. Pagkagising, diretso po sa laboratory para sa Scotch tape swab. And then repeated examinations on 7 consecutive days are necessary before the patient is considered free from infection. Occasionally, adult worms may be seen crawling from the anus at night. Ayan. So, di ba nga kasi yung gravid female, lumalabas po siya sa butas ng puwet during night time, after the child has been put to sleep. And if ever na makakita ng ganon, may lumalabas na parasite talaga dun sa puwetan natin, the worm po should be placed in alcohol and brought to the laboratory for proper identification. For the treatment, ito naman po ang good news sa ating Enterobius. Commonly, the infection is self-limiting and in the absence of reinfection, this can cease without treatment. Baka nga hindi mo lang napansin, nagkaroon ka na, tas gumaling ka lang because it is again self-limiting. But in case na kailangan ng treatment, ganun pa rin po tayo, mga azoles pa rin, albendazole, mebendazole, and parental palmate. These are effective against infection with the pinworm. To avoid reinfection in the family, since it is easily spread within the family, hence it is termed as a familial disease, it is customary to treat the entire family simultaneously if ever may isa pong nag-positive. Kasi po, ang ating mode of transmission dito may kasamang inhalation. Sometimes kasi yung ating eggs, pwede pong malagay siya sa mga kumot, bedsheet, tapos po pag nagpagpag ng ating bedsheet, mai-inhale or possible ma-inhale po yung ating embryonated egg. Kaya po, it's very common in the family na once na merong isang nagkaroon, kailangan magpa-test na rin po lahat. Or everyone should be treated simultaneously. So ito po, additional reminders for treatment, prevention, and control. Again, proper personal hygiene, especially hand washing before and after meals, and cutting of fingernails. It's very important po yung cutting of fingernails kasi po nga, isa sa symptoms nito is yung pangangati ng puwetan. So, pag nangangati kasi, di ba, nag-i-stuck sa fingernails yung ating mga parasites, and pag hindi po tayo naghugas ng kamay, nag-i-stuck po doon sa fingernails yon. So, it's a good thing po na i-cut yung fingernails para hindi po mag-stuck sa mga mahahabang nails. Things used by infected individuals like yung clothes nila and bed linens, bed sheets, it should be sterilized by boiling. Kasi ang ating parasite po, they can remain viable in surfaces. Like, yun nga po yung sa bed sheet, pag pinagpag, pwedeng ma-inhale. And then the most common again route of transmission is hand-to-mouth transmission from scratching the perianal fold. So habang nangangate, and then, kunwari, nangate, tas hindi naghugas ng kamay, tas kung merong mga tendency na mag-nail bite, ayun po, pwede nyong ma-ingest ang ating parasite. And aside from hand-to-mouth transmission, inhalation nga po from dust, like pag nagpagpag ng bedsheet. And yung third po na common, also auto-infection. Enterobius vermicularis is possible din po through auto-infection or self-infection. Okay, here next parasite, we have your Capillaria philippinensis. Capillaria philippinensis po, in this name, Philippines, si Capillaria po is na-discover po dito po sa Pilipinas. Kaya po pinangalanan siyang Philippinensis. Common name po ng Capillaria is the pudok worm and mystery worm. Pinangalanan naman po siyang mystery worm kasi there was a time na merong isang baryo dito sa Pilipinas na yung mga tao doon sa area or sa barangay na yun, bigla-bigla sila nagkasakit. Nagkaroon ng misteryosong sakit doon sa area nila or doon sa barangay nila. And then it was later on found out na ang nag-cause ng misteryosong sakit na yon ay ang Capillaria philippinensis. Hence the term mystery worm. So yun po yung story behind that. For disease association, Capillaria philippinensis is disease association, capillariasis. And yun nga po yung mystery disease, yung misteryosong sakit nga po na tumama sa isang baryo. So yun po yun. And then Capillaria is regarded as the smallest nematode. Mode of transmission is through ingestion of raw or undercooked fish. Ayan, yung mga kumakain po ng mga sashimi, mga undercooked na isda, mag-ingat po tayo sa Capillaria. And then, the infective stage here, we have the L3 larva. Ito po yung possible na pumasok sa katawan to cause diseases. While the diagnostic stage, yung stage that you can see in the microscope, is the egg peanut shape. Ito po yun, yung nasa screen. Eggs, peanut shape, mukha po siyang peanuts. With striations po, ito po yun sa gilid. And has a flat bipolar plug. Kanina po, na-discuss natin ang trichuris tricura na prominent bipolar plug. For the Capillaria, it is a flat bipolar plug. Meron din po siyang plugs dito sa kanyang gilid, kaso po it is flattened. Hindi po siya yung prominent. So, for the intermediate host, again, I'll just recall what is an intermediate host, guys. An intermediate host, again, is a host that harbors immature parasite, like larva. So, for the intermediate host of Capillaria philippinensis, it is commonly, again, fish. Kaya nga po, pwede siyang makuha sa pagkain ng raw or undercooked na isda. So, fish namely, bagsang, bagsit, at ipon. Common po ito sa mga provinces. Ayan, baka familiar din po yung mga terms sa inyo. So, mga isda po yan na nandito sa Pilipinas. But the definitive host of our Capillaria is humans. Again, when we say definitive host, ano nga po ibig sabihin nun? That harbors the mature parasite or adult parasites po. So, the one or the host that harbors the adult parasite again are us, humans. But aside from Capillaria philippinensis, we also have Capillaria hepatica and Aerophila. Okay, the provinces endemic in the Philippines are, when we say endemic, meron pong normal, steady cases or number of cases sa area nyo. So, endemic po ito sa area nyo. So, good example, we have Ilocos Norte, Ilocos Sur, Cagayan, La Union, Pangasinan, Zambales, Agusan del Norte, and Leyte. If you are from these provinces, mag-ingat po kayo sa pagkain ng raw or undercooked fish po. Okay, so here we have naman next is the life cycle. So here, the unembryonated thick-shelled eggs passed in the feces, lalabas po sa feces. And then yung feces natin can reach different bodies of water like yung mga ilog-ilog. And then once po na napunta po sa tubig ang ating embryonated egg, they become embryonated. So yun po yung eggs again. Eggs become embryonated once it touches the water. And then this embryonated egg, infected larvae develop into the tissue of an intermediate host which is si fish. Ang pwede kasing mangyari itong isdang to, makain niya po ito. And then inside of the fish body, magde-develop po yung larvae, which is the diagnostic stage or the infective stage rather. Infective stage nga po yung L3 larvae. Yung L3 larvae na yan magde-develop po doon sa ating laman ng isda. And then when an unsuspecting human ingested raw or undercooked infected fish, they can become infected with Capillaria. And then yun po, once na nakain na nga ng ating humans, ang ating infective stage, ganun lang, iikot lang ang life cycle, larvae to adult. And then yung adults natin, male at female, magme-mate sila, magpo-produce sila ng eggs or mga babies nila. And then yung ating mga eggs na yan, eggs, females may produce two types of eggs. Unembryonated, which is fast in the feces, and embryonated eggs lacking shells, which will hatch inside the definitive host. And then yung unembryonated egg nga po natin, lalabas po yan sa stool. Yung stool nyo mapupunta na naman sa bodies of water. And then, yung ating mga eggs, pwedeng makain ng isda inside of the fish body. Magde-develop yung infective stage na L3 larva. And then, yung laman po na ito, pwede po ma-ingest na naman ng humans. And then, ikot lang po yung life cycle. Lab diagnosis, the specimen is stool, commonly direct fecal smear. Additional lang po yung mga concentration techniques. And diagnostic stage again is the egg's peanut shape with striation with a flat bipolar plug. Again, that's flat bipolar plug. So ito po, picture lang no, to differentiate the Capillaria with the flat bipolar plug and the Trichuris vulpis or the Trichuris trichura na merong prominent bipolar plug. So ito po yung plugs ng Trichuris. Ayan, di ba? Very protruding, talagang taas po siya, while for the Capillaria is flattened po. Halos hindi na nga makita at all dahil flat talaga po ang polar plugs niya. So again, that's the Capillaria and Trichuris trichura egg morphology. For the treatment, yun, azoles pa rin, mebendazole and albendazole as the drug of choice. In severe cases of electrolyte and protein loss, electrolyte replacement should be given to the patient. And again, paano nga po na-acquire or what is the mode of transmission of Capillaria? So, di ba, nakukuha po ito sa pagkain ng raw or undercooked na fish. So, kung doon siya nakukuha, how do you prevent it? I-cook ng maayos ang isda. Fish should be thoroughly cooked to prevent diseases in man. Then, aside from thorough cooking, Proper sanitation, no? Wag pong dumudumi sa mga ilog-ilog kasi po, yun nga po, yung ating parasite, pag na-reach na po yung bodies of water, pwede pong makain ng isda natin na magiging intermediate host. So, kailangang iwasan po yun, proper waste disposal, and feces nga po should be properly disposed of, hindi po sa mga bodies of water directly. So with that, that ends the discussion for modules 4 and 5.